Hi, my name is Dr. Shah. I am a director of Life Force, where we treat a range of chronic diseases from world over, which includes a large number of cases of skin diseases. The skin diseases that we address at Life Force are mainly psoriasis, lichen planus, eczema, atopic dermatitis, vitiligo, etc. Now, one of the biggest challenges in the management of skin diseases includes the management of itching as a symptom. Many times patients are much more bothered about itching than even the scaling in cases of psoriasis or even lichen planus or eczema. Itching can become so intense, so troublesome that it may be really very hard to live life comfortably, especially even in the little babies. Now, when typically a patient of atopic dermatitis or eczema or psoriasis comes for homeopathic treatment, who may have been using certain anti-itching medications including corticosteroids or methotrexate or antihistamines. These patients, when they switch to homeopathy, and if at all they reduce those medicines or stop, the biggest problem is that the itching which flares up quite intensely, and this itching is very difficult to manage. That can throw a big challenge or crisis for homeopathic physicians as well as for the patients. How to manage this itching in the cases of psoriasis or eczema or atopic dermatitis? Let us talk about that. First of all, it is never advisable to stop immunosuppressive medicines when you are starting homeopathic treatment. If you are already taking local or topical or oral immunosuppressive medicines such as cortisone, you should first continue that and slowly taper it off over the period of time with the help of your homeopathic physician as well as your dermatologist. Once you reduce corticosteroids, there are chances that the itching will become more, and that time you might be required to use certain antihistaminic medicines to control itching. Because by the time homeopathic medicine takes over, it requires at least 6 to 8 weeks of time, and during this period itching might be so bad that patients might even give up homeopathic treatment. So the best thing is that let the patient take antihistaminic medicine so that itching remains under control. Now, besides occasional use of antihistaminic medicine during the period of the treatment, patients can do a couple of more things to reduce itching, especially for atopic dermatitis and and psoriasis, and that is use of moisturizer. Itching becomes severe, especially when the skin becomes dry in eczema and in psoriasis. So ample use of moisturizer is required to control itching. Couple of hours before the skin tends to become dry, you should use moisturizer. There are 4 or 5 kinds of moisturizers that you should use, which are usually accepted by most patients. 1. Coconut oil or olive oil, which is the simplest moisturizer, which can be very easily applied and which is cost effective. 2. You can use Vaseline. 3. You could use Petroleum jelly. 4. You could use Alovera or such kind of herbal based moisturizer. These moisturizers are known to reduce itching and will reduce the need to take antihistaminic medicines, and they go quite well with homeopathic treatment. Other important aspect of controlling itching is to make certain changes in the food habits. Patients consuming spicy food or hot food and chilies, they are known to have more itching. So I would like them to cut down on reduce spicy food intake. Next is the reduction of certain animal proteins. Patients who are taking meat and chicken, the animal proteins bring about a lot of changes in the immune system, which in turn could increase the underlying disease such as eczema or psoriasis, as well as the symptoms such as itching. So if you reduce your animal protein intake, the itching could become substantially less. So these are some of the tips that you need to take care of while when you are getting treated with homeopathy for the skin diseases such as psoriasis or eczema or atopic dermatitis. If you have more patients, please feel free to contact us anytime. Thank you so much.